Welcome back to Insight. We're at Indiana Physical Therapy here with Chrissy, and we want to find out about, what is this, osteoarthritis?
Yes. Osteoarthritis is a progressive disease. It affects your joints, but it could affect your cartilage, your bones, your muscles. It's usually a degenerative disease, and it causes some inflammation within those joints.
And so, because you put a big word in front of it, it's different than arthritis.
Well, osteoarthritis affects the joints. Usually it's on one side more than the other. There's rheumatoid arthritis, which is more of a systemic issue.
Okay, and so how does physical therapy help treat osteoarthritis?
There's a lot of different things we could do. We could assess the patient's range of motion and muscle strength and help find any deficits that they might have that causes some muscle imbalances and some shearing forces throughout that joint and therefore cause more pain. We do a lot of hands-on therapy, some joint mobilizations, which helps get the fluid going in and out of the joint. It helps nourish the joint, kind of lubricate it, little body WD-40 for you, get the joints moving. And then, like I said, we could give you some suggestions on modifying some behaviors you might be doing that might be aggravating your symptoms.
Is it one of those things that once I have it, I'm forced to live with it forever, or can treatment help just, make me forget all about it?
Right. Well, once you have it, but you could have flare-ups, and then you could have times where you don't really have pain. So physical therapy can help you deal with the symptoms and help you be able to do normal activities without as much pain.
So what's the difference, I guess, between osteoarthritis and just getting old?
Well, that's a good question. You could have arthritis and not have pain. You could have arthritis and have pain. You could get old and have arthritis. You could be young and have arthritis. So arthritis is just one condition that you have. As we get older, it tends to be more prevalent than when we are younger.
Okay, so when is, I guess, the first time that I need to see you? Is it when the pain finally hits, or is this something we can actually help preempt?
Yeah, well, a little of both. Usually people won't see me unless they have pain. That's usually the big thing. And it's usually if you have pain that kind of gradually gets worse and worse, it's gets a little bit more progressive as you go along, and you've been resting and doing what you think you should do, and it just doesn't go away. Then usually you'll see some medical advice for that. But there are some things you could do to help prevent arthritis. Usually light exercise is good for it, not putting too much stress through those joints. There was one study that showed that if you take 6,000 steps in a day, you're less likely to get knee arthritis than if you are more sedentary, don't walk quite as much.
And so what about running? Does that make arthritis worse? I mean, you're talking about knee stuff.
It's really dependent on, it's a very individualized thing. Again, you can have arthritis and run and not have a problem. You can have mild arthritis and run and have a problem. So that's why it's good to see a physical therapist and get an individualized evaluation, because there may be things we could do to get you back to running.
But in many cases, the worst thing you can do is nothing.
Correct, right, yeah. Sometimes people think, oh, I'm in pain, I'm not gonna move, I'm not going to do anything, and that could actually make things worse, because then again that joint gets more stiff and more dry, and then you're seeing me even later in worse shape.
I was going to say, so it's one of those things, if you're in pain and you're thinking, well, I don't want to go to physical therapy because that's going to hurt more. Not true, right?
Not true at all. I think some people are scared of physical therapists, don't know what we're going to do, but again, we could cater things, get your pain under management, and then get you back to your normal activities.
All right, and is this one of those with direct access? I should just come in and see you guys first, right?
Yeah, you sure can. You could give us a call. We could get you set up for that evaluation and see you for a couple visits and get you going.
All right, any of the many locations for Indiana Physical Therapy, you can find them all on their webpage, indianapt.com. We'll be right back on Insight.